This is Radio Health Journal. I'm Reed Pence. This week, examining what's called Medicare For All.
There's been a substantial increase in cost sharing that obviously people are not happy about. And this, in a sense, looks like a free lunch to many people.
So where would the money come from? We'll find out when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
Publishing is sort of a black box to authors. Even people who have been published don't really understand what happens once they hand their work over to the editor or to their agent.
The art, craft, and business of book editing. Then,
one small landscape is not going to make a huge difference. There's millions and millions of people with small landscapes. All together, we can make a huge difference.
Greener gardening during climate change. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes and Stitcher.
Americans have had it with their healthcare system. From the 9% of people with no insurance at all to the 35% of us under Medicare or Medicaid, and the half of the population with insurance from our workplace. Almost everyone has some complaint. Whether it's access or cost, few of us are happy, according to Dr. Paul Ginsberg, director of the USC Brookings Schaefer Initiative for Health Policy.
There certainly is unhappiness with what we've got. People are not happy with their $2,000, $3,000, $4,000 deductibles. They're not happy with how much they have to pay for prescription drugs. And so there's definitely unhappiness in the current system.
But should we blow up what we've got in order to fix it? Many policymakers say yes. However, the two groups that do want to take the system in opposite directions. Congressional Republicans and the Trump administration are seeking to scrap what's left of the Affordable Care Act, but as yet they have no replacement. While more than 100 Democrats in Congress, including at least 4 presidential candidates, are touting single-payer, government-sponsored health insurance for everyone, what's now being called Medicare For All. We'll take a look at the bill creating such a system, which has been introduced in Congress. It would free people from paying anything for virtually any kind of necessary care. Deborah Berger is president of National Nurses United.
It is completely comprehensive, and there are no barriers to getting access to the needed health care. There aren't any copays. There aren't any deductibles, so that very, very poor people will have access to dental care. They'll have access to nursing home care if they need it, and there aren't any insurance companies making the decisions about whether you qualify or not, or which hospital you have to go to. It is entirely up to you and your physician.
Over the past, say, 10 years, there's been a substantial increase in cost sharing in employer-based insurance and individual insurance that obviously people are not happy about. And this, in a sense, looks like a free lunch to many people. Wow, everything is going to be covered.
But as economists say, there's no such thing as a free lunch. Taxes would have to go up to pay for all that free care. But just how much, nobody really knows. And exactly where it would come from, nobody knows either. But Berger says what people are already paying, one way or another, would take care of a lot of it.
We have to be honest. It is not free. We are currently paying premiums, healthcare deductibles, there's payroll taxes, there are unions that have negotiated medical benefits. What we're saying is all the money that is currently being paid into the system through the Social Security tax, through the Medicare tax, through all of the various funding sources will be rechanneled and actually cost less. So we are paying for it. It isn't free, but there is plenty of what we call profit through the insurance companies that can be rechanneled once we eliminate the insurance companies.
During the 2016 presidential campaign, Senator Bernie Sanders proposed a Medicare For All plan, and he made financial estimates on its cost that are now what everyone else is working from. But few experts seem to accept the rosy financial scenario that Sanders paints. They say we'll need a lot more money to pay for the plan.
There's a collective agreement among outside analysts that have looked at the Sanders estimates that they're low by probably 50%, that they really overestimate the potential savings and dramatically underestimate the increase in the use of services by eliminating what people have to pay out of pocket.
That's Dr. Ken Thorpe, professor of health policy at Emory University.
The savings in terms of provider savings, how much you're going to cut payments to healthcare providers, how much you're going to save out of the home healthcare industry, the hospital industry, I think are just unrealistic. There's certainly savings to be had there, but not of the magnitude that they were talking about. And secondly, they just underestimated the increase in the use of healthcare services. When you think about it, there's two sort of general populations. There's the uninsured, whose spending would go up by 50 to 60%, which would be a good thing. It's one of the attributes of programs like the Affordable Care Act, which is trying to reduce the number of uninsured. But secondly, the average out-of-pocket payment right now for Medicare and for private health insurance is about 25%. And so by eliminating that for a very substantial number of people, again, you're going to have some additional use of healthcare services.
Looking at the Bernie Sanders bill from the 115th Congress from last Congress, that was scored by both a left organization, considered a left organization, I should say, the Urban Institute, and also by the Mercatus Center, a libertarian think tank. They both landed on that bill costing $32 trillion to American taxpayers in order to make sure that all the things in that bill were promised. And somebody even said that is a lower estimate. If you break that down, that's going to be a huge tax increase.
Lauren Crawford Shaver is executive director of the Partnership for America's Healthcare Future, a coalition of groups such as the American Medical Association, American Hospital Association, America's Health Insurance Plans, and the Pharmaceutical Research and Manufacturers of America. They're opposed to Medicare for All, and they'd rather tweak the Affordable Care Act to make it work better.
Proponents of Medicare for All have really pushed this notion that healthcare would, quote, be free. So by default, people would use the system more. I also think this type of proposal would push people to, quote, use the system differently. The on-demand healthcare that people just assume they can have is actually kind of a real problem. If everyone decided, oh, I'm on a plan, or I have access to an emergency room today, and use that as their primary care provider, that's going to be a problem.
Even if the cost did not go up, other than, let's say, we certainly have more people covered. We have 9% uninsured now, so let's say we could go close to 0% uninsured. That's not a very large amount to accomplish that. But to the degree that we substitute tax money for employer contributions and employee contributions for private health insurance, we're shifting large amounts of resources onto the tax system. Vermont confronted this when they got pretty far in designing their single-payer system for the states. And once they found out what the tax rates were going to have to be, they abandoned their quest.
Thorpe was the economist brought in by the state of Vermont to analyze whether they had any viable alternatives. So he's done this kind of analysis before, and he says it doesn't look possible. He says it would be politically unrealistic to raise enough tax money to pay for a nationwide single-payer plan, at least if it calls for no copays or deductibles.
If you raise the amount of money that you'd need to fund this, you would increase federal tax revenue by about 66%. So it would be an enormous increase in what the federal government collects in taxes.
Many people are skeptical that our country would ever stand for the magnitude of income redistribution that would be involved in moving from our current system, mostly employer-based coverage plus Medicare and Medicaid, to an all-Medicare system. there'd be lots of losers among the public, as well as lots of winners. And so that's hard to do in a democracy.
Ginsburg says the biggest winners would be people who can't afford insurance at all today.
But also those with lower incomes, who wouldn't pay as much of the taxes, and who, in a sense, what they pay either directly or indirectly for their coverage is very large in relation to their income. I think the losers would be the better off people. What employers pay and what they pay is a fairly small part of their income.
People on Medicaid and Medicare who now get their care for free but without a big tax bite could be losers as well. And, of course, insurance companies, which would cease to exist, and their employees who would have to look for new jobs. Most hospitals and doctors could be losers, too.
A lot of providers would be financially in trouble because they would receive essentially all of their income below their existing costs. And that's not to say they couldn't become more efficient. And certainly in many cases they could, but I think that's the concern is you have an entire revenue stream coming from one source that's currently, in many cases, paying below cost, raises a lot of concern.
A lot of hospitals are probably going to face bankruptcy if they too quickly, or even not so quickly, move from the revenues they have now to the revenues that they would get under Medicare rates for all their patients.
The Affordable Care Act was designed to do a lot of what Medicare For All intends to do, at least when it comes to getting everyone access to care. Crawford Shaver says in the last 10 years, access to both public and private insurance has increased by about 5%. So she says, fix what's already there rather than tearing it all down and starting over.
We don't need a grand slam home run bill every single time, but there are very smart incremental changes we can do that help start solving these problems that actually impact Americans' pocketbooks and their decision making. And so rather than sitting here and waiting for the potential of a big, massive plan, which we did 10 years ago through the Affordable Care Act, which made huge changes in a good way, why don't we start focusing in on those?
To eliminate and throw out the entire infrastructure that we currently have now that is building up to help make the Affordable Care Act work is probably a step in the wrong direction. So I think it's unnecessarily disruptive, unnecessarily expensive in terms of new taxes. And I think that there are more effective ways to achieve the same policy goals.
However, Thorpe says many of the very tools that have worked are the ones that have been attacked by repeal and replace advocates in the White House, Congress, and the Justice Department.
Subsidies to pay for out-of-pocket costs has caused a whole set of behavioral responses by health plans that are completely understandable but somewhat dysfunctional. The elimination of the individual mandate to buy coverage. Ongoing efforts to get people not to buy health insurance through the exchanges, but to buy them through short duration plans, association health plans, buying plans across state lines. Anything that they can do really on the opponent side to undermine the program has really taken place over the last couple of years.
So those on the political left may have their work cut out for them simply to build on to the Affordable Care Act. Medicare For All may be a pipe dream.
When I think of how close the Affordable Care Act, which was a very practical way of expanding coverage, how close that came to being repealed, the notion to think that a radical change like this could actually be enacted by a Congress in 2021 seems absurd.
You can find out more about all of our guests on our webpage, radiohealthjournal.net. I'm Reed Pence.
The American College of Physicians, or ACP, is an organization representing internal medicine physicians, or internists. ACP is hosting its annual meeting this week in Philadelphia so doctors can keep current on the most recent advances in patient care. ACP President Dr. Ana Maria Lopez explains why it's important for adults to consider an internist for their health care.
Internists are specialists in the complete care of adults, whether they are healthy or have a chronic illness. Internists are trained to diagnose and treat sudden illnesses, as well as complex medical problems. Adults with one or more chronic illnesses can especially benefit from an internist's comprehensive medical education and focus on coordinated care.
Internists undergo extensive training during their 3-year residency after medical school. Some internists subspecialize in specific areas, such as cardiology or endocrinology. Becoming a subspecialist requires an additional 1 to 3 years beyond residency. Learn more at acponline.org.
Individuals and businesses with tax problems, listen carefully. Do you feel like you're losing control of your finances? If you owe over $10,000 in back taxes or have unfiled tax returns, we can help you take back control. The IRS is the largest and most aggressive collection agency in the world, and they can seize your bank accounts, garnish your paycheck, close your business, and file criminal charges. Take control of your tax problem now by calling the experts at U.S. Tax Shield and take advantage of the Fresh Start program and new laws that may allow us to negotiate a settlement for the lowest amount possible. Our team of tax attorneys and enrolled agents can stop collections and get you protected so you can take control of your financial future. U.S. Tax Shield offers a price protection guaranteed quote to get you protected today. U.S. Tax Shield is A+ rated with the Better Business Bureau, so call now. 800-568-1647. That's 800-568-1647. U.S. Tax Shield. 800-568-1647.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.